Hello, everyone. My name is Marissa, and I am the clinical director for CWD. And I am so excited to have Alanna with me this evening.
Thanks, Marissa.
We get to talk about the best topic.
Alcohol and drugs, yes.
I will give everyone just a minute to sign in. And while we wait, I will let you know that our registration for CWD's Friends for Life Indianapolis just opened this past Friday. And you can check out all the upcoming conferences, including Indianapolis and Friends for Life Orlando at cwd.is/community. And with that, I will go ahead and read Alanna's bio for an introduction. So Alanna Landry has had the privilege of working alongside the T1D community as a pediatric diabetes nurse educator for 22 years at Markham Stouffville Hospital in Ontario, Canada. And after attending her first CWD Friends for Life in 2004, she was amazed and inspired by the experience and has been working in the teen program, I think, ever since. Right? Can you hear me?
Yep.
I think I froze. I'm sorry.
That's okay.
So with that, I will let Alanna get started. And for those of you that are participating, if you have questions, you can feel free to put them in the chat, or you can put them in the Q&A feature. And if you do the Q&A, you can do it anonymously as well. So go ahead, Alanna.
Great. Well, thanks, Marissa, for that nice introduction. And I will put in a word about coming to the conferences, whether it be Indianapolis, whether it be coming to Orlando. The most amazing, fantastic people, the experience, the education, all the feels that we get, being surrounded by people who just truly get it. Definitely, a one-of-a-kind experience. And I remember the first time we sent a family to the conference, the mom came back to me and said, "You told me I was going to learn a lot, but you didn't tell me how much I was going to feel." So so anybody even thinking about it, it's definitely a great experience. Yeah. So with that, I will start by sharing my screen. And of course, we practice this, and hang on, it will start here. And sorry about my messy desktop, but those are my grandchildren in the background, and we will start the presentation. So to start with, I called this presentation Influencers because we know both alcohol and drugs can influence the way we look at things, the decisions that we make, and how we approach things. So I went with influencers as a different kind of topic. And I saw this slide that Marissa kindly shared with me. Welcome to type 1 diabetes, where every day of your life is a science experiment. And when you add alcohol or drugs, it can complicate this experiment. So if every day you're balancing and juggling insulin, exercise, and then you add in alcohol or drugs, it's definitely a little more of a complicated situation. Alcohol 101. Ethyl alcohol is the ingredient that is found in beer, wine, and alcohol. The intensity of the effect of it is directly related to the amount of alcohol consumed and the rate at which you consume it. Individuals will always react differently to alcohol based on their family, their sex, physical condition, and obviously the amount of food consumed earlier on in the day, and the use of any other, whether it be prescribed medication or recreational drugs, will affect the alcohol intake and how your body responds to it. Oh, sorry, I'm having a hard time here moving to the next slide. Not all drinks are created equally. We know that on any given day, your body can respond differently to different amounts of alcohol. And just for example, just to equal out 3 different drinks, one 12-ounce beer will equal 5 ounces of wine in a glass or 1.5 ounces of pure alcohol shot. When we refer to blood alcohol concentration, it refers to the amount of alcohol circulating in somebody's bloodstream at any given time. And the reference for your BAC, if it's at 0.1%, it means that 0.1% of your entire bloodstream is composed of alcohol. And just to give you some idea, if your blood alcohol is at 0.02, that's when you start to feel slightly impaired. If you're at 0.08, you're too drunk to drive. And at 0.15, most people are very, very intoxicated or could black out. So some of the principles that we really talk to patients about is before they go, know as much as you possibly can. Oh, sorry. I don't know why my computer is doing that. I'm just going to quickly go through again and know before you go. Know your drinks. As I said before, different amounts of fluids and different drinks will have different percentages of alcohol in them. Wine, 20%, beer, 5%, and liquor, 40%. Know your mixes. Sometimes I will see people have just straight alcohol as a shot, or they will mix it with different fluids, whether it be water, juice, soda, or different sugar-free options. Knowing that piece will really give you the information that you need to be able to make good decisions around your diabetes management and the alcohol and the choices that you are making. Another thing we really emphasize with our patients is identify who in your group that you're going out with, one, is a designated driver and may not be drinking at all that evening, or somebody who just is really educated about your diabetes and would know what to do in an emergency, how to step in, and know that if you are drinking, that a low can look like being impaired, and know what to do and maybe how to test and check which it is and how they can help. And also know that along with alcohol, exercise can lower your blood sugar. So if you're going out somewhere and you're having a few drinks, and at the same time, people are going to be jumping around, dancing, a lot of activity, walking, whatever it is, that both of those two things together will both lower your blood sugar. And the other thing to remember, and again, we're emphasizing the lows related to alcohol, is that in an emergency, your glucagon, whether it be nasal or injectable, may not help to do the things that it should be expected to do if you are not having any alcohol at all. So we rely on glucagon, whether it be nasal or injection, to release stored sugar from the liver and get blood sugars back to a recovery level. When alcohol is present, that may not be possible. And I'll explain in just a little bit why that happens. And one thing we always talk about is testing your strategy. Now, you can't fully test it because there's always different things that will come into factor on the day that you actually are having alcohol. But have a situation where maybe you're not dancing and you can just check the effects of how alcohol will lower your blood sugar and what your blood sugar is in the morning, and see how your body generally responds to alcohol before adding in any extra factors. And just kind of having an idea of that will help kind of plan for an evening where you're going to be out and you maybe don't want to be thinking about it as much, and you know you have a little bit of a plan and you know how your body's going to respond. So when you go to a party or an event and you are drinking, one of the rules of thumb that we talk about is having 1 glass of water for every alcoholic beverage. This does 2 things. One, it slows down the consumption of alcohol, and it also can help prevent dehydration. So you're kind of doing 2 good things at the same time. You're delaying the work on your liver by giving it a little bit of a break in between, and definitely extending your evening, allowing there to be a little more time in between drinks. Another thing that I've had some of our patients say is if they pour their own drink. So if you know 1.5 ounces of alcohol is what a bartender would pour, maybe do half of that and have 2 drinks as opposed to the one with the full shot. Or you can do wine with Diet Sprite or some kind of soda, club soda, sugar-free mix. And that way you're just cutting the amount of alcohol. I've seen people do that with beer, and they just will, just so that they can have a few more and have less of the alcohol. Another thing is if you are drinking a lot of the coolers that have high sugar content, and you do want to cover a little bit of that carb with insulin, maybe only cover half. I know a lot of people will say, well, I know that my blood sugars are going to go later on in the evening, but at the time I don't want to have high sugars as well while I'm having the drink. And I only like coolers with sugar in them. So if that's the case and you have only the choice of having juice or something sugary in the drink, maybe consider giving a little bit of insulin for that, but not covering the full amount, knowing that your blood sugars will go low eventually, no matter how much carb or sugar is in that cooler or drink. If you are severely low or high and are having symptoms, others may just think that you're drunk. And then you want to make sure that you have that support person and you know who to go to say, hey, this has happened and can I get your help? And just make sure that always in the realm of safety, you are making sure that you've got that support system around you. And when I talked earlier about the glucagon maybe not working, most literature says that it will not work. But I wouldn't say in an emergency situation never to give it, because maybe it would provide some support. But the general consensus is that it definitely will not do what you need it to do in that situation. So what is your liver doing while you're having alcohol? Well, it's really busy processing the alcohol that you're consuming. And it's not able at that time to release the sugar that it normally does into your bloodstream. And it's also your liver doesn't know that you've chosen to drink. And so your Dexcom doesn't know that you've chosen to drink alcohol. Your pump doesn't know. Whatever technology it is that you're using, it doesn't have the ability to factor in that you've decided at that time to have some drinks. And if your liver's busy and your technology doesn't know, one of the things that we suggest are maybe to have some carbs and ensure that blood sugars are staying up and that you are in a safe space, especially before going to bed, and maybe have a plan for what you're going to do for the alcohol and for the possible low that can occur. So the factor is going to be, if you've just had alcohol and you're worried about a low blood sugar, Maybe you would put it on exercise mode. If you're on a control IQ, you could use exercise mode. If you're just setting a target blood sugar higher for the evening, maybe go up just a little bit, maybe 10% from where you normally are. If you've exercised and had alcohol, the general consensus is to maybe go down 20% for your basal overnight, or 20% of your long-acting insulin, whether it be Lantus, Tresiba, or any basal insulin, so that you can plan ahead and have control of the prevention of a low blood sugar. So the other thing is correcting blood sugars. So the evening, you're getting ready for bed and your blood sugar is on the higher side. Well, again, keep in mind that your blood sugar could go low. So giving an aggressive correction or a normal correction, a calculated correction that you would normally give is probably a little bit risky and unsafe because of the presence of the alcohol. So again, maybe if you normally give 5 units as a correction, give 2 or 3 instead, just to be on the cautious side. It's better to have higher blood sugars, not high so that you're feeling symptomatic or feeling crappy in the morning, but just a little bit above your target range overnight on a night when you've had alcohol, especially if exercise is present as well. And just kind of wake up in the morning and do your strong corrections or your regular corrections then. And these guidelines are from a nursing journal that was released on pumping and alcohol intake in 2011. So another tip or thing that we tell our patients is set an alarm. And this can be for you, this can be for a friend, a partner, a support person, just to check blood sugars in the middle of the night. Now, you might have technology that's alarming and will give you that information. But if you've had a few drinks and you are sleeping heavier than you normally would, it is nice to have somebody checking your blood sugar and making sure that all is well. And like I mentioned earlier, if you're on a pump with an algorithm, we suggest to our patients to use exercise mode. And again, this is just to set the target sugars a little higher than they would be regularly, just to get that safety factor and just that little bit of room extra to prevent any low blood sugars. And obviously, if vomiting occurs, seek medical attention. And that, again, is key, having your support person, somebody who knows, okay, this isn't okay. And it wouldn't be okay if they didn't have diabetes, but it's really not okay if they do have diabetes. So making sure that your support person knows who to call, when to call, and that you don't have one of these on your meter after alcohol has been taken, because you want it to be a good experience. You want it to be a safe experience. You want to be able to partake, and you just want to do it in a way that doesn't make your sugars go low and really allows you the ability to enjoy and have some real concrete safety plan type of strategies for navigating this. And so your bedtime snack. I asked the dietitians in my office, what would you say the best bedtime snacks are for if somebody has had alcohol? And they said, well, all the things that you would most want after you've had a few drinks or while you're having a few drinks. And those things would be something that is high in fat and also has protein in it. And that is to extend the release of any of the carbohydrates. And again, in the middle of the night when your liver is still busy processing alcohol and could cause your blood sugars to go low, you've got some extended fat and protein to keep your blood sugars up. So that was their advice. So, Marissa, do I want to answer any questions, or just move on to drugs?
I think either way. I
Okay.
usually try to do the questions at the end, but if anybody, I don't see anything just yet. So we'll go ahead and do them at the end. And so a reminder, oh, here we go.
Yeah.
There is a question about, do you usually give insulin for the fat and protein at that bedtime snack?
So no, because we really want to make sure that that fat and protein is used just to extend your carbohydrates and to allow it to help prevent that low. So as much as we do encourage people to calculate fat and protein for a large meal, and if they're using that formula, that's awesome, but only at the time of having alcohol or having some drinks, would we say no? I would err on the side of caution and not calculate for that.
Yeah, it's
Right.
a great question.
Yeah, absolutely. Okay, so I'll move on to recreational drugs, which, and I'm going to be 100% honest, I was less familiar. I am personally less familiar with, and the information and research on this was amazing and really, really interesting. So, obviously, or not obviously, the most common drug that is used is marijuana or cannabis, and it's legalized here in Canada, and I know it's legalized in some states in the US. There are different age restrictions depending on where you live and how you access it. It is legal in Canada to have 30 grams of cannabis in your possession. The component of cannabis that makes you high is the THC. And that is the piece that needs to be paid attention to, whether you're consuming THC in edibles or whether it's through vaping, smoking. And that is the psychoactive component that gives you the high that people use recreational drugs for. And the detectable blood levels of recreational drugs, I wanted to know that since we were looking at the alcohol levels, and 2 nanograms and 5 nanograms of THC. If it's higher than 2, you can be charged with impaired driving. And again, this was from Canadian information. I'm not 100% sure state to state if that's the same, but this is what we use here for what actually is impaired driving. So above 5, it's more serious, and obviously, absolutely zero driving with any recreational drugs is the most advised. Recreational drugs are mind-altering chemical substances that are used for non-medicinal leisure purposes. There is not a lot of research because before it was legalized, it was really frowned upon its use, and therefore there wasn't a lot of money put into the research. Now that it has been legalized, I suspect that there's going to be more and more research on all of the different drugs. And one things I do know about type 1 diabetes and recreational drugs, any of the drugs that increase your heart rate will affect your blood sugars. And cocaine is an example of this. And similar to an adrenaline rush, will cause blood sugars, or a stress reaction, you will see blood sugars go up. So let's just talk about cannabis, since it's the most common and somewhat legal in different places. Some of the current research I read from 2020 using the type 1D exchange showed that there is a 2 times increased risk of DKA with moderate daily use in people with type 1 diabetes related to their peers. And I found this really alarming, and really interesting. And the idea that the risk of DKA, so why are people with type 1 diabetes more at risk of DKA? And the fact that the use has doubled during the pandemic, I don't think any of us are surprised by this. And I don't think that this is really shocking to anybody. But some of the things that are related to cannabis use are that they're showing it can delay gastric emptying or motility of your gut, meaning that your food is just not passing through and being absorbed the same way it normally is. Again, not a lot of research on this, but this is just the early evidence is showing this. And that to remember, cannabis is addictive. I think we were all told that marijuana was not an addictive substance, but the research is showing in about 20% of the people, it can be addictive. Okay. Short-term use of cannabis. Well, when you use it, it impairs your ability to make decisions. And most importantly for us is your decisions around your diabetes care. It can increase your appetite and will have an overall effect on your blood sugars. Sometimes if your ability to make decisions is impaired, you might forget or miss an insulin dose. You could be eating more than you generally would in a certain, like in a seating. And you may also not have the ability to detect a low blood sugar as well as you normally would, or maybe at a level that you normally would. Long-term use of cannabis. So there is something called CHS, or cannabis hyperemesis syndrome. And this can be caused when somebody uses cannabis daily for a long period of time. And it basically can happen out of the blue where they just have a period of vomiting. Of course, with type 1 diabetes, that's very alarming and can come with its whole set of complications. You can have high triglycerides with long-term use of cannabis. Again, the increased risk of DKA. Now, the increased risk of DKA, a lot of that has to do with the cyclic vomiting or the cannabis hyperemesis syndrome. If you start throwing up and your blood sugars and you're unable to get that under control, you get dehydrated, your risk of DKA is quite high. And definitely that complicates your diabetes management. And again, we know that with that impaired state of being and your ability to care for your diabetes, we know that cannabis causes increased appetite, and therefore large amounts of food will be taken, and the impulse control or the ability to stop or keep that contained is a little bit different because you are not able to entirely regulate how that's all going to stop or continue. So this little cartoon, when you're waiting for blood sugars to come back up and you're trying to not overeat, I mean, I think when blood sugars go low, you already have that I don't want to stop at 15 grams of carb, or, it's an impulse to want more and more. And if you're impaired with by using marijuana or cannabis, you just don't have that ability to stop. And dealing with high sugars after a low and rebounding blood sugars, again, it just complicates your diabetes management and makes it more challenging. And that's kind of the end of my presentation. And I wanted to thank Marissa for inviting me to chat today. And as well, thank my amazing patients and families who teach me every day. I've had more teenagers teach me more things about alcohol and drugs, and really try to get my vocabulary up to speed. And and I even asked one of them, do you think the name influencers is a good thing? And he actually said, yeah, that's actually kind of cool. So thank you to all of the people that I get to enjoy my days with at work.
Amazing. Thank you so much, Alanna. That was a lot of really important information. And I think, one thing I wanted to ask you is, what do you think is the best age to start talking to your child about this? And I know that, of course, just like diabetes, development is the same, where every kid is going to be different. So
Right.
I don't know if there are things that we should be asking our kids to find out about their peer social behaviors or say things like that.
I think that's a really great question, because I would say what happens at our clinic is sometimes the parents will say, I've heard some of the friends are going out. My child's not doing it right now, but I think it's worth, sometimes preventative information is the best. So the answer to the what age, I say starting as young as 12, we start talking about alcohol. And even if they're so not ready to hear it, if we repeat it over and over again, and we always say, listen, we're not saying that's what you're doing, and you're not legal, and you should only be drinking alcohol when you're of age to do it. But if your family's having drinks on a Sunday and you'd like to do some experimenting, this is a great opportunity. It's really family dependent. It's really culturally dependent. And I really like, if I have a family say, we like to have wine on, and they're 12 or 13 and we'd like to give them a glass. Awesome. Use this as an opportunity so that that same child doesn't end up going to a party and never having. I love controlled environments and having those open discussions, and parents who are open to really supporting that at an appropriate age. And I agree, every kid is different, every family is different, and sometimes they're the youngest sibling, sometimes they're the oldest sibling, and that really makes a big difference. But you can never start talking about this too early in clinic with your healthcare professionals. And I love when the parents call ahead of the clinic appointment and say, hey, we're coming into clinic and I don't want to be the one to bring this up, but could you just, and then we cover it. It should be part of every kid who's transitioning from the time they're 12 right through, not just alcohol and marijuana, but vaping. We talk about smoking. Those are all so important to do as young as possible. And the thing, Marissa, is sometimes shocking. I think I'm getting old and I'm maybe thinking, oh, well, they're not even in high school yet. But these are important things to talk about as young as possible.
Right. And I think that's the perspective that we take at Friends for Life conferences. We always want to make sure that we're getting this information to them, because it's a matter of safety. And you know what? We were all young and without our frontal lobe development, just like them, and we made poor decisions.
Mm-hmm. If they're going to make poor decisions, let them have that little piece. And maybe they don't know everything that we talked about on this slide presentation, but I'll tell you what, if the only thing they know is no matter how sweet this beverage is or what I'm taking, I could go low, then that in itself is the most important piece.
Absolutely. And I'd like to ask a question about, you just mentioned it, but about when it comes to marijuana use and using things that are like either vaping or smoking, I know that has a little bit of an increased risk compared to other things. Could you touch on that?
As far as overall health, 100%. And with diabetes, the risks of smoking, we don't have a ton on the vaping yet. Now, we know it's dangerous for all teens, and more information and literature is coming out, but we do know smoking, and we know how dangerous it is for youth with type 1 diabetes to be smoking. And it's really good sometimes to show them the numbers, but the problem is teens want to do what their friends are doing. And why should this be so much different for me? I have type 1 diabetes, I'm already having to do a lot. And I think as caregivers and parents, and the more information we give them about how risky smoking is with type 1 diabetes compared to their peers, I have even been caught saying to a parent, if you have to pick one thing, let them have a drink at home safely with you. I would rather that than ever see your child pick up a cigarette. And not that we're bargaining or wanting one versus the other, but just from a big picture overall health, we know that smoking is so dangerous.
Yeah. And I think, just to make sure that everybody on the viewing this later knows that, for smoking cigarettes,
yes,
with nicotine, which I believe vaping also has nicotine, but
some do. I think they can choose. Yes.
And I think that is the problem with that type of smoking is risk of cardiovascular problems. So we are already at higher risk for complications with our arteries and our veins and things like that. And, of course, heart disease, which really affects everybody. But with diabetes, we just have that extra risk. So that's the big reason that we try, to discourage smoking cigarettes. I don't think it has the same kind of risk to smoke marijuana. I don't think it does, but I think
it does not.
Anytime that you're inhaling something into your lungs, it does cause it. There is a slight risk of something, right?
Absolutely. Your lungs were not made for that.
Yeah. And especially, I think it's nice now, in my opinion, where it's legalized, because at least that you're getting something that has been a little bit more vetted than, going through a drug dealer where, the odds are just a little scarier that way. So.
Well, I think people who are using it are more knowledgeable because they know the actual amount of THC contained in it. It's measured. It's it's approved. The risks are a little bit less. You still don't know how your body's going to respond, but you are actually taking a measured dose.
Yeah. And I think for anything, I think it is really, like Alanna keeps saying, it's really helpful to have a parent or a trusted older sibling, maybe someone they know that has diabetes or that understands how to take care of them, when they start experimenting with things. Just be with them the first time and hopefully, have them have like a sober companion. Especially with alcohol and, drugs that are going to really affect your mental status. Having a buddy to be your backup.
And I think the open discussion, and if we're looking at the pandemic and the psychology research articles that I was reading, the mental health of our young adults, whether it's teenagers or, people in general, people are looking for ways to, socially drink or use recreational drugs. And if we're having open discussions and saying, my friends are all doing this, I'm going to do it, and knowing what they are up to and what the choice that they're making, okay, well, if you're going to have a couple drinks, you can't mix both, or try one and not the other. Don't do them together. That could be the worst outcome. So really having open, clear communication. If you're going to try something, and if you're ever worried, call me. I will come, and that's your backup safety plan. Yeah, I agree, Marissa. You can't be safe enough.
No, and I think, for families who are less comfortable talking about it, I love the idea of calling ahead before the clinic visit, or you can send messages on My Chart. I love My Chart. It makes my life so much better.
Yeah.
And, you can also, I know at least pediatricians in the US, they are supposed to sort of ask for one-on-one time with the provider and the teenager or the young adult, so that they can ask things that maybe they wouldn't be comfortable asking in front of mom or dad.
100%. And parents should and teens be saying, can I see one of the clinicians? It can be the physician, the educator, the dietitian. I know our dietitians do a lot of education on alcohol, just because sometimes they get in there one-on-one, maybe a little easier than when the physician's there. But any team member, the best thing you can do is, if you have an individual question or something that is really important to you, but you don't want to ask in front of a spouse, a partner, or a parent, I think it's really important to get that one-on-one time and get your answers.
Absolutely. And, along with all of these topics, asking questions about sex and contraception. I mean, earlier that we
alcohol and drugs can sometimes skew your ability to make good decisions, even in that aspect. So, that's when risky behaviors occur. And so making sure that you have all of your preventative measures in place.
Absolutely.
Yes.
The nicest way to say that.
That's what I was thinking.
Yeah. Well, I think this was spectacular. Are there any other, maybe, I don't know, tips or tricks for talking to your kiddos? I think that can be hard.
I think one of the things I love when they call ahead, but normalizing and not ever saying, well, their friends are all doing. I have so many people come in and say, well, their friends are all going out. Well, probably at some point, your kid, if this is their group of friends, your child will join, or your teen or young adult. And, not letting their first year of college or university be their trial ground. I just so often say, please, 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 the summer before they leave, whenever it is, find a time to do this in a safe, secure environment with their friends from high school, where their support, they all have known each other forever, not a group of strangers that you can't rely on. It's first year university, everybody's together. And, again, making sure somebody knows about your diabetes. So just controlling for as many uncontrollables as you can.
Absolutely. And, the only other thing I was thinking, well, we just had a question about if this is going to be, if there's a way to watch the recording. And yes, this will be uploaded hopefully by the end of this week. And yeah, this is also another option, is sending this video to your teen or your young adult who, needs to learn about these different things.
Sometimes it's easier to hear it in private. And this is the way teens and young adults learn these days. They don't want to sit and hear a lecture, or maybe it's embarrassing in clinic. But if they knew, wow, I'm at twice the risk of getting into DKA, and the last thing I want is to be in DKA and have all my parents and all my friends know that I needed to go, to emerge to get this because I started vomiting or whatever. It's really, really beneficial for them to be able to get this information in a way that is most useful to them.
Absolutely. And the only other thing I wanted to mention was I would recommend encouraging your kids who are less interested in participating with their peers in these activities to use diabetes as an excuse. And, that's something that I did when I was younger, and I didn't want to start drinking yet, I would say, oh yeah, well, I have diabetes, so I can't drink. And, nobody knows, nobody's going to question this. So it's a nice, easy in your pocket, peer pressure, just, get out of jail free card, if you will.
100%. And, but I've had some parents tell their kids that because they have type 1 diabetes, they can't drink. And, I really want to make sure that they have true, factual information on what it does, just in case they're. And one of the other things I came across in my research, especially about drugs, recreational drugs, and the Psychology Today article, is a lot of solitary alcohol consumption and marijuana consumption. So, we are thinking pre-pandemic, when kids were all getting together and there were a lot of parties and there was a lot of socializing. Some of that's not happening, but the use has actually doubled for both alcohol and marijuana. So if the use has doubled, we're going to assume that this is happening whether they're all together or whether they're alone. So making sure that all of our antennae are up and that we're supporting, educating, giving as much information as we can so that they are well equipped to handle diabetes as well as whatever else is going on.
Absolutely. I think that was so lovely. I really appreciate it. I don't think we have any more questions. So I think we will stop now. And I just want to say thank you again, Alanna. I really appreciate it. And for everyone who attended, thank you. Thank you for your questions. And check out the conference page on CWD's website, which is cwd.is/community. And we will have this video posted under the Screenside chat section of the CWD website.
Great. Thank you, Marissa.
Thanks, Alanna. See you soon, I hope.
Yes, I hope so.
Bye.
Bye.